Welcome to the inaugural video for the Neurology Review Pearls video channel. I'm Dr. Robert Fichetti, and I'm going to talk to you about the chemistry of dopamine and related chemicals, and we'll actually find out what 5-hydroxytryptophan really is. So if you look over here, I showed this molecule to a room of MDs, and they had no idea what it was. But this is actually phenylalanine, and as you see here, what we've done going from phenylalanine to this chemical, which you should know is tyrosine, is we added an OH or hydroxyl group. So this is actually phenylalanine hydroxylase, and if this reaction is stopped, you have PKU or phenylketonuria. The next step in this pathway is from tyrosine to levodopa, and you'll actually see that again all we've done is add a hydroxyl or OH group to the molecule. So now we have two of them, and levodopa, believe it or not, all of these are L amino acids. Levodopa is L3, so we go 1, if you count this as 1, 1, 2, this way, 1, 2, 3, and then 1, 2, 3, 4. So it's L3, 4 dihydroxy phenylalanine. So levodopa, which is the main sort of medication or supplement that's used in Parkinson's disease, is actually 2 steps away from phenylalanine and 1 step away from tyrosine. So essentially it is an amino acid, and as such, that's why the bottle label on levodopa has a warning on not using or not taking too much protein at the same time, because to the body, to the GI, and also to the blood-brain barrier transporter systems, this competes with other amino acids. So anyway, we've got to levodopa with tyrosine hydroxylase, and again, this is the rate-limiting step of the pathway. After this step, levodopa, then there's a chemical called, or an enzyme, aromatic amino acid decarboxylase, which actually converts to dopamine. Now, let's look further. Going from dopamine over to this molecule, that's actually norepinephrine, and you see here that we added an OH, but it's in a different location. And that would be dopamine beta hydroxylase. There's actually a disease called DBH, or dopamine beta hydroxylase deficiency, where you have less norepinephrine, and the disease itself gives you neurogenic orthostatic hypotension. It gives you low blood pressure withstanding. If we go back to dopamine itself, dopamine is degraded by 2 enzymes, MAO, monoamine oxidase, and COMT, catechol O-methyltransferase. If you use MAO first, it makes this molecule, which is called dihydroxyphenylacetic acid, or DOPAC, and COMT then converts it to homovinylic acid. The other way is that COMT converts it to 3-methyl-tyrosine, and then that actually gets converted by MAO to homovinylic acid. So this is the pathway for dopamine, sort of in a nutshell. If you can think about the kind of diseases, so certainly deficiency of dopamine gives you Parkinson's disease, but there are also Dopa Responsive dystonias, which again, as the name suggests, these are diseases where you have dystonia, which is abnormal muscle contraction leading to an abnormal posture, or excessive muscle contraction leading to an abnormal posture, and it's Dopa Responsive, which means that it gets treated with levodopa, and we'll talk about that a little bit later. We'll mention another pathway here. So this is tryptophan, also an amino acid. Tryptophan hydroxylase converts this into 5' hydroxytryptophan, or 5' HTP, which is the supplement that I'm holding here. And 5' HTP gets converted to serotonin by aromatic amino acid decarboxylase, and we'll mention this a little bit later as well. So as far as the relevant inherited disorders here, Sagava syndrome is a syndrome of GTP cyclohydrolase deficiency, which is needed for tetrabiopterin synthesis. And this is a cofactor of multiple reactions, including tyrosine hydroxylase, which is the rate-limiting step for making levodopa. DYT5B, or autosomal recessive Sagava syndrome, is a direct tyrosine hydroxylase mutation. Again, that's the rate-limiting step for making levodopa. So, but we have to take a look at where else is tetrahydrobiopterin necessary. So if we go back, so it's not just at the tyrosine hydroxylase step over here, but it's also important at the step between phenylalanine and tyrosine, and namely phenylalanine hydroxylase. So in patients that have the GTP cyclohydrolase deficiency, you may, depending on the degree of deficiency, need to restrict their phenylalanine intake to avoid a phenylketonuria-like syndrome. In addition, GTP cyclohydrolase is needed for tetrahydrobiopterin, which is a cofactor for tryptophan hydroxylase, which is the rate-limiting step for making serotonin. So you need to know that in patients who have GTP cyclohydrolase deficiency, you need to supplement them with 5' HTP in order for them to have adequate levels of serotonin. And let's look at one more neurotransmitter. So over here you have glutamic acid, and glutamic acid decarboxylase, or GAD, and the subtype that's used in nerve cells is GAD65, makes GABA, or gamma aminobutyric acid. So if you look from glutamic acid, I mean, we just cut out, it's a decarboxylase, we remove that carboxylic acid group, and we make gamma aminobutyric acid, which is a negative or sort of calming neurotransmitter. And GAD65 antibodies are antibodies against this rate-limiting step. Those patients don't make GABA, and that's one of the causes of stiff person syndrome. Thank you very much for watching. Please hit the subscribe button, and please take a look at my book, Neurology Review Pearls, which is available on iTunes, iBookstore, and also on Amazon.com. Thank you.